I think the main reason why I got into practicing physical therapy was that I knew I wanted to do something in the medical field. And when I was in college, I was pretty active physically, to sports, working out, and the field of physical therapy seemed to be a perfect fit for me. And after doing it for about 15 years, it really has panned out to be exactly what I thought it would be, helping people recover from injuries and getting them back to functioning without limitation. I got into physical therapy having always played sports my entire life. I was always interested in exercise and anatomy and how the body worked. So after I graduated high school, I went on to play basketball. I drew, and I was always kind of interested in athletic training and rehab and injuries.
I played rugby, and I had an accident. I dislocated my shoulder pretty bad, and the doctors had to wrestle it back in, so I had to go for physical therapy for a couple weeks. And I really enjoyed working with my therapist. He seemed like he loved his job. He was really good at it, and I always kind of kept that in the back of my head as a possible profession.
So the difference between integrative physical therapy and other clinics that I've worked at, it's very patient-centered. We're a small office. It's very hands-on, intimate setting. We have private treatment rooms. It's not one of those open gym concepts where there's multiple plinths where people are right next to each other. You're kind of just out in the open.
There's less distractions. It's relatively small, which I think is a good thing. We have 3 therapists here, myself, Frank, and Bill. It's easy at other practices for patients to kind of get lost among the sea of therapists that work there. Here it's kept very tight.
It's not a place where you're being handed off to several different people within the clinic. You're mainly working with your physical therapist. We have constant contact with our patients. You email us on a weekend, you're going to be responded to that day.
You get to work with people one-on-one, which I feel is pretty rare in our days.
Being actually able to see your patients get better without limitations, I always find that to be very rewarding. You're spending one-on-one time with people on an individual basis, face-to-face, for as long as we do at Integrative Physical Therapy. Being able to help them, being able to teach them, and give them the tools they need to get back to what they want to do, whether it's just living a pain-free work day or going out and running a marathon or just being a weekend warrior. Really forming a relationship with a patient over the course of a few years. We've had patients that have been coming here for 5, 6, 7, 8 years now. They have come back and they have things that pop up. And then having that trust factor that they know that they can rely on me and my practice to come in and feel like they're going to get better. And even more importantly, that they will refer family and friends and coworkers to this office. That is really probably one of the second most rewarding things, is that people trust me in the office and the therapists that work here, that they're going to give good care to the point that they're going to refer people. I mean, that's the biggest compliment that you can get.